Hello, this is Ed Udris presenting an update on the Discuss COPD study. Discuss COPD is a project within the VA Query Safety and Quality Initiative conducted at the Bedford VA and the Center of Innovation at VA Puget Sound in partnership with the VA Office of Specialty Care and Pharmacy Benefits Management. To provide a summary of why we're trying to de-implement inhaled corticosteroids, we know that inhaled corticosteroids are commonly prescribed to patients with COPD by their primary care provider. However, inhaled corticosteroids are also associated with an increased risk of pneumonia. And we know that when ICS are discontinued, the risk of pneumonia falls by 40% after approximately 90 to 120 days. The primary aim of this study is to reduce the use of low-value inhaled corticosteroids among patients with COPD, where an ICS is either inappropriate or there are safer alternatives. Secondary aims include the acceptability of the intervention to PCPs and patients, rates of pneumonia and COPD exacerbation, mortality, and an economic analysis. The study design is a cluster randomized trial of primary care teamlets or PACTs and their patients. The intervention is a proactive pulmonary e-consult to the primary care provider, including unsigned orders for the PCP to accept or decline as they see appropriate. Patients targeted for the e-consult have a clinical diagnosis of COPD, have had spirometry, and are receiving inappropriate inhaled corticosteroids. The intervention began in the fall of 2016 with the final e-consults delivered at the end of this past January. The orange curve demonstrates overall recruitment for the Discuss trial. In terms of findings thus far for the Discuss project, the project enrolled 542 patients, of which 269 were reviewed for the intervention. Of these, the pulmonary team recommended de-implementing inhaled corticosteroids for approximately 60% of the patients. Of these, approximately 90% of orders were accepted or signed by primary care providers. Some challenges we encountered: documentation is often quite poor, making it difficult to understand why a patient was started on an ICS in the first place, as well as whether they may have had an indication for an ICS at all. Differing standards for interpreting airflow obstruction and lack of complete evaluation for COPD by clinicians are also common issues we encountered. To better understand provider and patient perspectives and to identify common issues, we are continuing to conduct surveys and qualitative interviews. Baseline and post-intervention surveys of primary care providers have been completed, with a long-term follow-up survey to be administered this spring. Common themes identified to date among PCPs are lack of awareness that ICS increases the risk of pneumonia, and that effective alternatives to ICS exist. Additionally, providers are often unwilling to stop a medication started by another provider. And as far as the intervention, while the intervention itself is complete, data collection for the 6-month follow-up of primary and secondary outcomes will continue through July of 2019. The Discuss team thanks you for your time and support.